Hi everyone, welcome back to my YouTube channel. Today we are going to talk about temporal bone, and here at the side you can see the diagrammatic representation of external surface of temporal bone and diagrammatic representation of internal surface of temporal bone. So let's start our topic with introduction. Temporal bone is one of the most complex and significant bone of skull. Positioned at the side of the and base of skull, its intricate structure supports vital functions such as hearing, balance, and facial movements. Now let's talk about anatomy of this temporal bone. It is located on both sides of skull. The temporal bone articulated with several other cranial bones contributing to overall integrity and functions of the cranial structure. They encompass a wide range of fractures features including ear cells, canals, and foramina, each serving specific roles that are critical for auditory and vestibular system. Now let's talk about division of temporal bone. Temporal bone is divided into four main portions, each with distinct anatomical properties and clinical roles. These are squamous portion, tympanic portion, mastoid portion, and petrous portion of temporal bone. Now let's talk about them one by one. The first is squamous portion of temporal bone, as you can see here in the diagram. This is thin, flat, and often highly pneumatized region forms the anterior and superior part of temporal bone. It contributes to the lateral surface of skull and is an area where muscle and fascia attaches. Its smooth surface also provides articulation with the parietal bone forming part of the cranial vault. Next portion of the temporal bone is tympanic portion. It forms the anterior wall and floor of external auditory canal. The tympanic portion of temporal bone play a crucial role in conducting sound waves towards the middle ear. This region houses the structure integral to transfer of auditory information, bridging the external and middle ear components. Next portion is mastoid portion of temporal bone. It is recognizable by its conical shape. The mastoid portion is named for its prominent mastoid process. This area is pneumatized by numerous air cells that communicate with middle ear, which aids in regulating ear pressure and protecting against infection. Additionally, the mastoid process serves as an attachment site for neck muscle, aiding to the neck strength and mobility. Next portion is petrous portion of the temporal bone, as you can see here in the diagram. It is the most robust and dense segment of the temporal bone. It houses the inner ear structure, including the cochlea and vestibular system, which are essential for hearing and balance. Its hardened structure provides a strong protective casing for these delicate sensory organs, and the complexity of petrous portion make it a subject of intense study in both anatomical and clinical contexts. Now let's talk about functional significance of temporal bone. The first is auditory function. It is one of the temporal bone primary role is to contribute to the hearing mechanism. The external auditory canal formed by tympanic portion directs sound waves toward the tympanic membrane, and these vibrations are then transmitted through the ossicles in the middle ear, culminating in stimulation of the cochlea within the petrous portion. The precision of this design is fundamental for effective sound transmission and perspection. Next significance is the vestibular function. It is embedded in the petrous portion or key components of the vestibular system, the semicircular canal and otolithic organs, which manage balance and spatial orientation. The intricate network of bony and membranous labyrinths within the inner ear allow for the registration of head motion and position, enabling smooth execution of movements and coordination. Next functional significance is structural and protective function. It is beyond its auditory and vestibular function. The temporal bone adds to the overall strength and stability of skull. It supports the housing of critical neural and vascular structure, including passage for cranial nerve and blood vessel. The bone's robust construction is often highlighted in discussion of cranial fracture and surgical intervention, which frequently involve careful navigation around these key areas. Next clinical significance is the complex structure of temporal bone often means that pathology arising in this region can be far-reaching consequences. Several clinical conditions highlight the importance of thorough understanding of temporal bone anatomy. The first, this kind of condition is cholesteatoma. That is abnormal skin growth that can develop in the middle ear and mastoid portion. It results from chronic ear infection and can lead to destruction of surrounding bone, resulting in hearing loss and imbalance if left untreated. Next clinical significance is mastoiditis. That is infection that affects the mastoid ear cell and may lead to mastoiditis. a potentially serious condition that requires prompt medical or surgical intervention to prevent the spread of infection to the central nervous system. Next clinical significance is temporal bone fracture. Traumatic event can lead to the fracture of this bone, and such fracture can disrupt auditory and vestibular function and may also comprise the nearby facial nerve, leading to the muscle weakness and paralysis. Next is clinical significance is surgical intervention. Owing to its dense architecture and the close proximity of cranial neurovascular structures, surgeries involving the temporal bone, whether for tumor resection, cholestoma removal, or cochlear implant placement, demand a high level of expertise and precision. Surgical planning is greatly aided by imaging techniques like computer tomography, which provide detailed views of temporal bone structure. Further talking about clinical significance, it has significance in radiological imaging and it has its role in radiology. Advancing in radiological imaging have dramatically improved the diagnostic and surgical landscape associated with temporal bone pathologies. CT imaging is particularly valuable as it allows clinicians to assess the anatomy in great detail, identify subtle fractures, and plan precise intervention. This non-invasive imaging modality underscores the importance of technology in modern otolaryngology and neurosurgery. Now let's talk about development of temporal bone. The complexity of temporal bone reflects on evolutionary journey of increasing specialization. As from a simpler structure in early vertebrates to the intricate architecture seen in modern humans, the temporal bone has evolved to meet the demanding requirements of auditory and vestibular precision. This evolutionary perspective not only enriches our understanding of human anatomy but also provides insight into the adoptive significance of hearing and balance. Now let's talk about significance of it. The temporal bone is far more than just a component of skull. It is multifaceted structure vital to both sensory and perception and overall cranial stability. Its distinct anatomical region each contributes uniquely to auditory, vestibular, and structural function. Understanding the detailed anatomy and clinical implications of temporal bone is essential for both medical professionals and students, offering insight into the sophisticated interplay between form and function in human biology. And this was all about temporal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.